If you should require assistance during the call, please press star then 0. I would now like to turn the conference over to your host, Supervisor Kathryn Barger. Please go ahead.
Thank you and good afternoon. I'm Supervisor Kathryn Barger, Chair of the Los Angeles County Board of Supervisors. Tomorrow is Armed Forces Day, and I'd like to thank the men and women who serve our military for their dedication and their sacrifice. Their commitment makes us safer, and their work makes our community stronger. We owe you a debt of gratitude we can never repay, but we will do everything in our power to try. We sincerely thank you for your service. In celebration of our first responders and healthcare workers, our Air Force Thunderbirds are flying over Los Angeles County today. Look up in the sky between 1:30 and 3:10 p.m. to see if they are flying over your neighborhood. Their flight path is listed on the Air Force Thunderbirds social media pages. I encourage you all to get out and look up. As we highlight efforts that bring our community together, we are making strides to reopen more of Los Angeles County. This week, we opened nearly all retail businesses for curbside pickup and delivery, putting hundreds of workers back at their job. Many recreational sites are reopening, including parks, botanic gardens, lakes, boat launching, and dog parks. I know my district residents are looking forward to heading back to Descanso Gardens and La Cañada Frontage, and Antelope Valley residents are excited to go fishing at Fin and Feather, in addition to many other countywide. With some guidelines, the Department of Parks is resuming their activities. Residents are welcome to enjoy golf, trails, tennis, pickleball, trap and skeet, archery, shooting ranges, equestrian centers, model airplane areas, and community gardens. Additionally, the department will resume free snack programs at some parks and will reopen outdoor restrooms during the day. By providing more access to the outdoors, we're taking meaningful steps to slowly bring our community back together safely after we have spent so much time apart. Many of us have seen different areas across California that have begun to slowly reopen. Last week, Governor Newsom introduced guidance to county governments on the variants to Stage 2 of California's roadmap to modify the stay-at-home orders. By doing so, the governor is allowing counties that have met certain benchmarks to move to the next stage of reopening business to avoid devastating delays. This effort acknowledges and appreciates the diversity of California. Los Angeles County is equally diverse with communities that are as urban and rural as the entire state. I think it's important for cities to be able to meet their own benchmarks and safely reopen so they are not dependent only on the county. The cities of Santa Clarita, Lancaster, and Palmdale have approached me to discuss how they can meet the benchmark criteria. I have asked County Council and the Department of Public Health to provide an analysis on any variances that would enable cities, if possible, in Los Angeles County to meet their own benchmarks and move to the next stage of reopening. But understand, we have to do this taking into consideration public health. I know that working together, we are on a path to safely returning to the activities that make LA County so special. With that, I would like to introduce Dr. Barbara Ferrer to give you the daily stats. Thank you.
Good afternoon, everyone, and thank you so much, Supervisor Barger, and thanks to the entire Board of Supervisors. Your excellent leadership for LA County has provided us with a focused path forward during these unprecedented times. I want to update you on our current status. I'm sad to report 47 additional people have died from COVID-19. 37 of these people who died were over the age of 65, and 30 people over the age of 65 who passed away had underlying health conditions. 5 people who passed away are between the ages of 41 and 65, and 2 people in this age group had underlying health conditions. Information on the 5 deaths reported by the City of Long Beach is available at longbeach.gov. This does bring the total number of deaths to 1,755 across LA County. For all of you in our communities who are mourning someone you love who's passed away from COVID-19, our hearts ache for you, and you are in our thoughts and our prayers every single day. 92% of the people who have died from COVID-19 continue to be a group that's has underlying health conditions. And I also want to note that 40% of the people who died with underlying health conditions, for the most part, were under the age of 65. More people are going to be out of their houses and about now that we're in the early stages of our recovery journey. And this means that there's a possibility that infections can spread more rapidly. So if you do have an underlying health condition, this includes chronic lung disease, asthma, a serious heart condition, HIV, or another condition that could affect your immune system, it is important that you continue to do your best to stay home as much as possible. And if you begin to feel sick, please contact your provider immediately. And I would like to urge people to make sure that they have a provider and can call 211 if they don't, to get connected to a provider. Even mild illness in a person with underlying health conditions during a pandemic is cause for concern, and it's absolutely cause for you to connect with a healthcare provider. Today, we're also reporting 962 new cases, and this does bring the total number of people who have tested positive for COVID-19 in LA County to 36,259 people. The 36,259 total cases we're reporting do include 1,157 total cases reported by our partners in the city of Long Beach, and 662 total cases reported by the city of Pasadena, which have independent city health departments. We're not able today to update our numbers on people experiencing homelessness because we had a delay in getting that information this morning, but we will update everyone again on Monday. There are 5,727 people who were positive for COVID-19 that have had, at some point during their illness, been hospitalized, and this is 16% of all of our positive cases. Currently in our hospital, there's 1,733 people who tested positive for COVID-19, and 25% of the people who are in the hospital today who are positive for COVID-19 are in the ICU, and 16% of these people are on ventilators. As we continue to see the slight decreases in the number of people who are hospitalized over the last week and a half, we are encouraged. We have investigated a total of 415 residential congregate settings and non-residential settings where there's at least one confirmed or suspect case of COVID-19. These settings do include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, correctional facilities, workplaces, food and retail, and educational settings. The total number of confirmed cases in institutional settings is 9,103, and this includes 5,895 people who are residents and 3,208 people who are staff. And I will be sharing more updates on our work in the skilled nursing facilities early next week. We are waiting some of the results from testing that was completed this week. I am sad to report that 892 people who were living in institutional settings have in fact died from COVID-19, and this represents 51% of all of our deaths. And the vast majority of the people who lived in institutional settings did reside in our skilled nursing homes. So to the families and the friends of the people who have passed away, our hearts go out with you, to you, and we mourn with you the passing of your loved ones. And I want to also note that for all the families of people who are residing in our nursing facilities and who are working in our nursing facilities, please know that we're working as hard as we can to make sure that we're doing everything we know how to do to keep these facilities as places where people are as safe as possible. We are currently beginning a new round of inspections at every facility by our health facility nurses. And as I mentioned, I'll provide an update on all of this work early next week. We're also reporting today 532 confirmed cases at some point in the jail facilities. It's 415 among people who are incarcerated and 117 among staff. The increase in cases is due to the testing of all the people who are quarantined at the men's central facility. And a number of people who were tested were positive, and the vast majority of them were asymptomatic. As the test results continue to be processed, we'll likely continue to see an increase in these cases. The Sheriff's Office is also reporting for their facilities today that there are 265 people who are incarcerated that have tested positive for COVID-19, 150 people who are incarcerated and have recovered, 369 people who are incarcerated and are in isolation, and 4,739 people who are incarcerated and quarantined. There's 164 cases in the state prison, and 118 are among people who are incarcerated, and 46 are among staff. And 674 cases are being reported from the federal prison facilities, and this represents 661 among people who are incarcerated and 13 among staff. And again, the vast majority are folks who are at Terminal Island, and again, there was a lot of testing that was done at that facility. There are now 16 cases in the juvenile facilities, 4 among youth and 12 among staff. We do post daily information by facility that includes the number of positive and suspect cases, as well as the number of people who have died among residents and staff. We also post an updated report with all of our cases, and we have a dashboard that really gives information on testing, cases, and deaths. So please go to our website, publichealth.lacounty.gov. The LA County Sheriff's Department is reporting 149 positive cases among staff, 383 staff are quarantined, and 979 staff have returned to work. The LA County Fire Department is reporting 205 staff members that have tested positive for COVID-19, that have been tested for COVID-19. Let me repeat that. The LA County Fire Department is reporting that they tested 205 staff people. 20 of them, and only 20 of them, tested positive. They have 23 staff members who are isolated at home, 18 staff members that have returned to work, and 4 that are at home sick. And I want to thank Sheriff Villanueva and Chief Osby for sharing this information with us every day. Over 282,000 COVID-19 test results for individuals have been reported to the LA County Department of Public Health, and 11% of the people who were tested were positive. I want to again thank the Department of Health Services and Dr. Christina Galley for doing an extraordinary job increasing access to testing over the last couple of weeks. There are, as a reminder, appointments that are available at the regional testing sites, and you can go to covid19.lacounty.gov/testing to make an appointment and to find a location. I do have an update today on our race, ethnicity, and income level data that we're collecting and we look at closely to better understand how COVID-19 is impacting some groups more than others. For the 1,615 people who have passed away where race and ethnicity data has been identified, 38% are Latino or Latinx, 29% are white, 18% are Asian, 12% are African American, 1% are Native Hawaiian or Pacific Islander, and 1% identified with another race or ethnicity. As I mentioned a couple of times before, in order to help us better understand what these numbers mean, we create rates, which means we look at the number of deaths per 100,000 people for each of these population groups. This allows us to make some comparisons across populations, and it does really reveal more information about disproportionality. The death rate among African Americans is 22 deaths per 100,000 people. And among people identifying as Latinx or Latino, the death rate is 19 per 100,000 people. For people who are Asian, the death rate is 15 per 100,000 people. For people who are Native Hawaiians and Pacific Islanders, there's only a small number of deaths, so we have an unstable rate there, which is between 55 deaths and 150 deaths per 100,000 people. That's just because of the fact that there's a very small number. Regardless, even if it was at 55 deaths per 100,000 people, that would demonstrate a lot of disproportionality that's being experienced by our Native Hawaiians and Pacific Islanders, friends and family members. For our white residents, the death rate is 11 per 100,000. And when you look at this data by community poverty levels, you also continue to see that people who live in areas where there are high rates of poverty have over 3 times the rate of deaths from COVID-19, 34 deaths per 100,000 people, compared with those people who are living in communities with very low poverty levels who have a death rate of 9 people per 100,000. As I noted before, this data is extraordinarily concerning, and it does require immediate collective action. And I want to thank all of the community partners and county partners who have been helping us engage in the following activities. One thing was identifying strategies beyond the internet to ensure that the public can easily make appointments at testing sites, get the language support that they need if they don't speak English, and locate testing sites where there may be extended hours, since many people are working during the day. It's clear that residents also need access to good information in their native languages, so we're continuing to do a better job translating our documents and offering media updates in various languages. We're also working with local healthcare providers, health plans, and professional organizations to problem solve around the issues that are related to scarcity in testing supplies, to scarcity in personal protective equipment at some of the smaller clinics, to making sure that there's the availability not just of testing but of healthcare services, and of course to link those who need support to the additional services that the county is offering to help people during these catastrophic times. All of this would allow for the ability to improve the diagnosing and early care and treatment of people with COVID-19. This important information and our partnerships with our community organizations and their leadership allows us to move forward in a way that makes sure that we are not only paying attention to the numbers, but we're actually doing something to really ensure that the disproportionality does not continue. I also want to note that today we're going to begin posting our recovery dashboard on our website. This dashboard tracks our current status on important data indicators, which assesses our progress on continuing to slow the spread of COVID-19 in LA County. We're using this information to guide us on how and when it's sensible to relax additional restrictions so that we can reopen more businesses across the entire county. And there are 2 important questions that we need to always be answering through our recovery journey. The first question is, how capable are we of slowing the spread of COVID-19? This means, do we have everything we need in place to make sure we can continue to slow the spread? And the second question we ask is, how effective are we at preventing the spread of COVID-19? This would help us understand if the actions we're taking together are really continuing to work. Slide number 2. For the first question about our capability, we have 5 measures that we're watching closely. First, we look at whether or not we have enough available beds in our intensive care units. So every day we look at the total number of available beds to make sure that we're at least have 10% of all of our ICU beds are available should patients need to be transferred into the ICU. We also will look at the availability of ventilators in our hospitals. And again, when we're looking at this information, we want the total number of available ventilators to be at least 20%. These 2 measures help us know that our hospitals are not in danger of being overwhelmed. We also need to make sure that healthcare workers have the personal protection that they need to be as safe as possible while they work. So we look to be sure that at least 60% of all of the hospitals have a 15-day or more supply of personal protective equipment. We assess our capacity to do COVID-19 case investigations by making sure that 90% of all of the newly reported cases are followed up within 1 day of being referred to us for investigation. And we also are looking to make sure that we're able to offer 15,000 COVID-19 tests every day in the county. This helps us make sure we have the capability to slow the spread. And to understand, I'll go to the next slide, if we're continuing to slow the spread, there are an additional 4 measures we'll look at. First, we need to make sure that our average daily deaths have either decreased or remained stable for the last 14 days. And we will be tracking deaths by race, ethnicity, and community poverty levels to be sure we're not seeing any increases in some groups. This will be extremely important for ensuring that the steps that we take to relax restrictions are not inadvertently contributing to further health inequities. We do want to be sure that our actions have also not resulted in an increase in hospitalizations. And for this, we look at the average of the number of people who are currently hospitalized for COVID-19. And again, we want this number to decrease or remain stable. Another important need for us is to continue our efforts to protect those who are residing and working in our nursing homes. So we will look at nursing facilities that have 1 or more COVID-19 cases and make sure that 90% of these facilities have been offered testing to all residents and staff in a timely manner. We will be posting these numbers on our website, and I encourage you to help us mark our progress together on our ability to continue to slow the spread. And as we begin this weekend with more places reopening, I want to thank everyone who's done their part extraordinarily well to slow the spread of COVID-19. As you heard from Dr. Galley yesterday, we have in fact reduced the rate of the number of people that are infected by everyone who is infected, and we're now down to infecting 1 person for every infected person. And we started our journey at 3 people were becoming infected by every person who was infected. And that's only because of all of the work you've done. So I ask you to continue to practice physical distancing, continue to wear your cloth face coverings when you're among other people, because these actions work. This is your way of keeping other people safe. Thank you very much, and now we'll go to questions.
If you wish to ask a question, please press 1 then 0 on your touch-tone phone. You may remove yourself from queue at any time by pressing 1, 0 again. If you're using a speakerphone, please pick up the handset before pressing numbers. Also, out of courtesy for others, please limit your questions to 1 or 2. One moment, please, for the first question. Looks like we have a question from the line of Dave Lopez. Please go ahead.
Hi, Dave.
Yes, good afternoon to both of you. Happy Friday. Doctor, in a little more in details on how we can advance. The last 3 days, more than 3,000 people have been infected. Is that an alarming pace, or the pace that we're on now, would that enable us to maybe invoke the idea that the supervisor, and I'd like her to weigh in on this as well, how would that exactly work, and how soon could that work, that where city by city could open up rather than wait for the entire county to open up?
Well, I'll start by answering that part of it, and then I'll let Dr. Farrar talk more in detail. But I know that the 3 cities that have contacted me up in the Antelope Valley, their numbers have been low, and they want the opportunity to work with public health based on the governor's criteria to see if they can do it as a regional approach. And so I don't have a position at this point other than to ask both county council and public health to look at it and see if it can be done, because the last thing I want to do is to put us in a place where we go back to square one with safer at home. But arguably, if you look at their numbers and what they're talking about in terms of criteria, most of the criteria they can meet, but I'll let Dr. Farrar talk about the second half of that.
Yeah, thanks a lot, Dave. So we have been holding steady at about 1,000, on average, about 1,000 new cases every day. You'll notice in our benchmarking, sort of the measures that we're looking at, we don't really measure how effective we are at slowing the spread right now in terms of the number of positive cases. And the reason for this is, you know, thanks to Dr. Galley and before Dr. Galley, we had Dr. Kazan at the fire department. You know, we've really been able to ramp up testing, but it is true that the more testing you're able to do, the more people you'll find who are positive. And that's all good for us. Finding people who are positive, getting them isolated and into care quickly, and figuring out who their contacts are is the most important thing we can do. So having a lot of testing will result in more cases, and we're prepared to manage that. Where we're worried is if we were to see the fact that we had more cases ended up resulting in a lot more people in the hospitals, and we ended up not meeting our hospital benchmarks, that would be a cause for worry. But at this point, you know, we're just really excited about the opportunity to get more people tested. That's the easiest way for us to actually be able to manage a pandemic, is test a lot of people, find those who are positive, isolate and treat the people who are positive, and then make sure that their close contacts are being quarantined. We'll take the next question.
Next question comes from the line of Claudia Pascude with KNX News Radio. Please go ahead.
Hi, Claudia.
Hi, I honestly can't. Hi there. I can't remember, Barbara, but I think you said you were going to give us an update today on the inflammatory syndrome numbers. Sorry if I got that wrong.
The what numbers, Claudia? The what numbers?
The inflammatory syndrome for the children. You know, the mysterious inflammatory syndrome affecting children.
Yep.
I'd asked about that yesterday.
Yes, thanks a lot. Our team has sent out a survey to all the PICUs, the pediatric intensive care units, and we haven't gotten them all back yet. So I can't report the numbers just because we haven't gotten all the information back. You know, some of the units are having to go back in time because it wasn't just to look at who's in the intensive care unit right now. We actually were looking at whether there were other children that met that case definition who were there a while back. So, but we're working on that, and we'll get it to you as quickly as possible. There's time for one more question.
And we have a question from the line of Alex Wigglesworth with LA Times. Please go ahead.
Hi, thank you. I actually have two questions. So there are people now who are starting to see friends again. Is that okay as long as you keep 6 feet apart from them? And do you have any advice on how to do it safely, or is it still dangerous? And then my second question is, Mayor Garcetti's order for the city of LA says anyone outside doing things like running or cycling must wear a cloth face covering. But we've heard from public health officials that it can also be dangerous to wear a face covering while exerting yourself in hot weather. So how should we deal with this?
Yeah, thanks so much for both questions. So yeah, you know, seeing friends, you know, we're not recommending that at this point in time. We are recommending that you continue to do your distance, you know, you do your distancing in the ways that we've recommended before using technology. But we do appreciate that there are some circumstances where you may be around some other people. And in those circumstances, you're absolutely right. We do recommend at least make sure you're keeping that 6-foot distance and that you're in fact using a cloth face covering to try to protect other people, and they should do the same to protect you. But no, we're not recommending at this point in time that people should be in social units together. But I like your question because it acknowledges the reality is as people are about more, they are going to be seeing other people a lot more. And while we're not recommending, you know, you have dinners with your friends, et cetera, we understand that there may be circumstances where there are other people near you who you know, and in those circumstances, please keep your distance and keep your face coverings on. And I know there are, you know, I want to say I live in the city of LA, and the rules in the city of LA are you are to have a face covering whenever you go out, and I would encourage everyone to adhere to the executive order that's here in the city. Our health officer order says that you need a face covering when you're going to be around other people who are not in your household. So if you're going to be in contact with other people who are not in your household, we do urge you to always use that cloth face covering. It is, if you're out in hot weather and you're exerting yourself, you know, please, if you are going to be around a lot of other people, you have to take a lot of care because it can be dangerous. If you're running hard, for example, if you have that cloth face covering over your mouth and your nose because it does make it more difficult for you to breathe. We encourage people who want to do exertion that's going to task their lungs to please do that in a solitary way. Go for a solitary run so that you're not around other people. I've said it that the purpose of wearing the cloth face coverings is to protect others. It's really important when you're with other people that you have it on, but if you're by yourself, you're in your car by yourself, you don't need to wear that cloth face covering. But notice, if you live in the city of LA, you need to follow the orders from the mayor. And now we'll have remarks in Spanish.
Buenas tardes. Para actualizarlos, nos da tristeza informar que 47 personas adicionales han fallecido por causas de COVID-19. Esto eleva el número total de fallecimientos a 1,755 en el condado de Los Ángeles. 92% de las personas que fallecieron tenían condiciones delicadas de salud. El 40% de las personas que fallecieron eran menores de 65 años. Hoy estamos reportando 962 nuevos casos. Y esto eleva el número total de personas que dieron positivo por causas de COVID-19 en el condado a 36,259. 5,727 personas que dieron positivo fueron en algún momento hospitalizados. Esto representa 16% de todos los casos positivos. Actualmente hay 1,733 personas que dieron positivo que están hospitalizadas. El 25% de estas personas están en unidades de cuidados intensivos y el 16% de estas personas están en ventiladores. Y seguimos viendo reducciones en el número de personas que están hospitalizadas en las últimas 2 semanas. Más de 282,000 resultados de la prueba de COVID-19 han sido reportados al Departamento de Salud Pública y el 11% fueron positivas. Hay citas disponibles en los sitios de prueba regionales y puede hacer una cita en covid19.lacounty.gov/testing. Hoy tenemos un informe sobre los datos de raza, etnicidad y nivel de ingresos que estamos analizando de cerca para comprender cómo COVID-19 está afectando a algunos grupos. Para las 1,615 personas que fallecieron donde se identificó la raza e etnicidad, 38% son latinas, 29% son blancas, 18% son asiáticas, 12% son afroamericanas, 1% son nativas de Hawái o islas del Pacífico y 1% son de otra raza o etnicidad. Como mencioné, para mejor comprender lo que significan estos números, analizamos estos números como tasas por cada 100,000 personas en cada uno de estos grupos y nos permite hacer mejores comparaciones entre la población, y estos números revelan más sobre qué los grupos se ven desproporcionadamente afectados. La tasa de mortalidad entre los hawaianos nativos y los isleños del Pacífico es de 104 por 100,000 y para los afroamericanos la tasa de mortalidad es de 22 por 100,000. Estas tasas son significativamente más altas que la tasa de mortalidad en otras razas y etnicidades. Eso nos tiene profundamente preocupados. Para las personas que se identifican como latinos, la tasa de mortalidad es de 19. Para las personas asiáticas, la tasa de mortalidad es de 15. Y para los blancos, la tasa de mortalidad es de 11 entre cada 100,000 personas. Y cuando observamos estos datos por niveles de pobreza en la comunidad, vemos que las personas que viven en áreas con altas tasas de pobreza tienen más del triple de fallecimientos de COVID-19, 34 por cada 100,000 personas. En comparación con las comunidades con niveles de pobreza más bajos, que tienen una tasa de mortalidad de 9 por cada 100,000 personas. Hoy empezamos a publicar nuestro tablero de recuperación en nuestro sitio web. Este tablero rastrea nuestro estado actual en los datos importantes que nos ayudan a evaluar nuestro progreso en disminuir la propagación de COVID-19 en el condado de Los Ángeles. Estamos utilizando esta información para guiarnos sobre cuándo es sensato relajar las restricciones para que abran más negocios en nuestro condado. Hay dos preguntas importantes que debemos hacernos mientras nos movemos hacia la recuperación. Primero, ¿cuán capaces somos para frenar la propagación de COVID-19? Esto significa que si hacernos la pregunta, ¿tenemos todo lo que necesitamos para asegurarnos de continuar reduciendo la propagación? La segunda pregunta es, ¿qué tan efectivos somos para prevenir la propagación de COVID-19? Esto nos ayuda a comprender si las acciones que estamos tomando para frenar la propagación están funcionando. Para la primera pregunta sobre nuestra capacidad, tenemos 5 medidas que observamos de cerca. Primero, si tenemos suficientes camas disponibles en nuestras unidades de cuidados intensivos. Cada día veremos el promedio de los últimos 3 días. Queremos que el número total de camas disponibles sea de al menos el 10% de todas las camas de unidades de cuidados intensivos. También veremos la disponibilidad de ventiladores en nuestros hospitales. Nuevamente, observando el promedio de 3 días, queremos que el número total de ventiladores disponibles sea de al menos del 20%. Estas 2 medidas nos ayudan a saber que nuestros hospitales no estén en peligro de ser abrumados si vemos más casos. También debemos asegurarnos de que los profesionales de la salud tengan el equipo de protección personal que necesitan para estar lo más seguros posible mientras trabajan, por lo que nos aseguraremos de que al menos el 60% de los hospitales tengan un suministro de equipo de protección personal para 15 días o más. También seguimos evaluando nuestra capacidad para realizar investigaciones de casos de COVID-19, asegurándonos de que al menos el 90% de los casos recientemente reportados se han seguido dentro de un día de ser emitidos para investigación. Y también buscaremos asegurarnos de que podamos ofrecer 15,000 pruebas del COVID-19 cada día. Para comprender si continuamos desacelerando la propagación de COVID-19, hay 4 medidas. Primero, buscaremos asegurarnos de que el promedio de nuestros fallecimientos diarios hayan disminuido o permanezcan estables en los últimos 14 días. Y realizaremos un seguimiento de los fallecimientos por raza, etnicidad y niveles de pobreza de la comunidad para asegurarnos de que no veamos aumentos significativos en algunos grupos. Esto será extremadamente importante para asegurar de que los pasos tomados para relajar las restricciones no contribuyan a nuevas iniquidades en salud. Queremos asegurarnos de que nuestras acciones no hayan resultado en un aumento en las hospitalizaciones. Por eso vamos a analizar un promedio de 3 días en el número de personas actualmente hospitalizadas por COVID-19 y queremos que este número disminuya o permanezca estable. Otra necesidad importante es continuar nuestros esfuerzos para proteger a quienes residen y trabajan en nuestros hogares de ancianos. Vamos a examinar a los centros de enfermería que tienen un caso o más de COVID-19 y nos vamos a asegurar de que el 90% de estos centros hayan ofrecido pruebas a todos los residentes y personal. Publicaremos estos números en el sitio web del Departamento de Salud Pública. Y ahora we move on to Armenian remarks.
Բարի օր բոլորին։ Շնորհակալ եմ վերահսկիչ Բարգերին եւ վերահսկիչ մարմինների ողջ խորհրդին։ Այսօր ցավով հայտնում ենք եւս 47 մահվան մասին։ Այս մարդկանցից 37-ը 65 տարեկանից բարձր են, որոնցից 33-ը ունեցել են ուղեկցող առողջական խնդիրներ։ 5 անձի տարիքը 41-ից 65-ն է, եւ 2-ը ունեցել են ուղեկցող առողջական խնդիրներ։ Սա բերում է ընդհանուր մահերի թիվը 1755-ի։ COVID-19-ով մահացած անձանց 92%-ը ուներ ուղեկցող առողջական խնդիրներ, ինչը կարևորում է այն անձանց, ովքեր առողջության լուրջ խնդիրներ ունեն, մնալ տանը եւ հնարավորինս խուսափել սերտ կապերից։ Խնդրում ենք հիշեք, քանի որ մենք տեղափոխվում ենք վերականգման եւ սահմանափակումների դանդաղորեն վերանում են, եթե ունեք առողջական հիմքում ընկած հիվանդություն, շատ կարևոր է հնարավորինս տանը մնաք։ Այսօր մենք հայտնում ենք 962 նոր դեպքերի մասին, եւ սա բերում է Լոս Անջելես շրջանի դրական դեպքերի ընդհանուր թիվը 36259-ի։ Այս դեպքերը ներառում են Լոնգ Բիչ քաղաքում մեր գործընկերների կողմից գրանցված 1157 դեպքեր, իսկ Փասադենա քաղաքի կողմից գրանցված 662 դեպքեր, որոնք ունեն անկախ առողջապահական բաժանմունքներ։ 5727 դեպք ինչ-որ պահի հոսպիտալացվել են, որը կազմում է բոլոր դրական դեպքերի 16%-ը։ Ներկայումս հոսպիտալացվել են 1733 մարդ, որից 25%-ը գտնվում են ինտենսիվ խնամքի բաժանմունքում, իսկ 16%-ը միացված են շնչառական օդափոխիչների։ Ներկայումս քննություններ են կատարվում 415 ինստիտուցիոնալ բնակության հաստատություններում։ Դրանց թվում են ծերանոցներ, ապաստաններ, բուժման կենտրոններ, ուժանդակվող բնակելի հաստատություններ եւ քրեա կատարողական հիմնարկներ։ Ինստիտուցիոնալ միջավայրում հաստատված ընդհանուր դեպքերը 9103-ն են, ներառյալ անձնակազմ եւ բնակիչները։ Այս դեպքերից բնակիչները կազմում են 5895 եւ անձնակազմը կազմում են 3208։ Ցավով ենք հայտնում, որ այս հաստատություններում COVID-19-ով մահացել են 892 բնակիչ, որը կազմում է բոլոր մահերի 51%-ը։ Մենք զեկուցում ենք, որ հաստատված 532 դեպքեր արձանագրվել են քրեա կատարողական հիմնարկներում, 415 դատապարտյալ եւ 117 աշխատող։ Ավելի քան 282,000 մարդ տեստավորվել են եւ արդյունքները զեկուցվել են Լոս Անջելես շրջան, որից 11%-ը դրական են։ Ես ուզում եմ քաջալերել ձեզ տեստավորվել, եթե ունեք ախտանիշներ, տարածաշրջանային տեստավորման վայրերում։ Ժամադրության համար կարող եք այցելել covid19.lacounty.gov/testing։ Էթնիկ պատկանելիության եւ եկամտի մակարդակի տվյալները։ Էթնիկ եւ եկամտի մակարդակի վերաբերյալ տվյալների մասին, որոնք մենք հավաքում ենք եւ ուշադիր նայում հասկանալու համար, թե ինչպես է COVID-19 ազդում որոշ խմբերի վրա։ 1615 մարդիկ, ովքեր մահացել են, կազմում են 38%-ը կազմում են լատինո-լատինեքս, 29%-ը սպիտակ, 18%-ը ասիական, 12%-ը աֆրոամերիկացի, 1%-ը բնիկ հավայան եւ 1%-ը գրանցվել է որպես այլ ռասա եւ էթնիկ խումբ։ Աղքատության բարձր մակարդակ ունեցող բնակավայրերում ապրող մարդիկ ավելի քան 3 անգամ գերազանցում են մահացության դեպքերը COVID-19-ից։ Այս տվյալները խիստ մտահոգիչ են եւ պահանջում են հավաքական գործունեություն։ Մենք աշխատում ենք մեր համայնքի եւ շրջանի գործընկերների հետ հետեւյալի վերաբերյալ։ Մենք նաեւ աշխատում ենք տեղական բուժ աշխատողների, առողջապահական ծրագրերի եւ մասնագիտական կազմակերպությունների հետ։ Լուծելու համար խնդիրը, որը կապված է փորձաքննության պարագաների սակավությամբ, անձնական պաշտպանիչ սարքավորումների փորձքննություններից դուրս առողջապահական ծառայությունների առկայության եւ այլ օժանդակ ծառայությունների հետ, ինչպիսիք են բավարարել COVID-19-ով ախտորոշման եւ բուժօգնության վաղաժամ բուժումը ապահովելու ունակությունը։ Վերականգնման աղյուսակ։ Այսօր մենք կսկսենք փակցնել մեր վերականգնման աղյուսակը մեր կայքում։ Այս վահանակը հետևում է մեր ներկա կարգավիճակի տվյալներին եւ սա կարևոր ցուցանիշ է գնահատելու Լոս Անջելես շրջանի COVID-19-ի տարածումը դանդաղեցնելու առաջընթացը։ Ամեն օր մենք կանդրադառնանք անցած 3 օրվա միջին ցուցանիշին։ Մենք ուզում ենք, որ մատչելի մահճակալների ընդհանուր թիվը լինի բոլոր մահճակալների առնվազն 10%-ը։ Մենք նաև կդիտարկենք մեր հիվանդանոցներում օդափոխիչների առկայությունը։ Կրկին նայելով 3 օրվա միջինին, մենք ուզում ենք, որ առկա օդափոխիչների ընդհանուր քանակը լինի առնվազն 20%։ Այս երկու միջոցները օգնում են մեզ իմանալ, որ մեր հիվանդանոցները չեն կարող գերագնահատվել։ Մենք նաև պետք է համոզվենք, որ բուժ աշխատողները ունեն իրենց անձնական պաշտպանիչ սարքավորումները, որպեսզի նրանք աշխատեն հնարավորինս անվտանգ։ Հիվանդանոցների առնվազն 60%-ը ունի անձնական պաշտպանիչ սարքավորումներ 15 օր կամ ավելին։ Մենք կգնահատենք COVID-19-ի գործի քննության անցկացման մեր կարողությունը, համոզված լինելով, որ նոր հաղորդված դեպքերի առնվազն 90%-ը հետևում են քննության ուղարկվելու պահից 1 օրվա ընթացքում։ Եվ մենք նաև կփորձենք համոզվել, որ մենք ի վիճակի ենք ամեն օր 15,000 COVID-19-ի թեստ առաջարկել։ Հասկանալու համար արդյոք մենք շարունակում ենք դանդաղեցնել COVID-19-ի տարածումը, կան 4 միջոցներ, որոնք մենք կվերանայենք։ Նախ մենք կփորձենք համոզվել, որ վերջին 14 օրվա ընթացքում մեր միջին օրական մահերը կամ նվազել են, կամ կայուն են մնացել։ Եվ մենք հետևելու ենք մահվան դեպքերը ըստ ռասայի, էթնիկ խմբերի պատկանելությամբ եւ համայնքների աղքատության մակարդակով, որպեսզի համոզվենք, որ որոշ խմբերի զգալի աճ չենք տեսնում։ Դա չափազանց կարևոր կլինի այն բանի համար, որ սահմանափակումները մեղմելու ուղղությամբ ձեռնարկված քայլերն անխուսափելիորեն չեն նպաստում առողջության հետագա անհավասարություններին։ Մեկ այլ կարևոր անհրաժեշտություն. շարունակելու ենք մեր ջանքերը պաշտպանելու նրանց, ովքեր բնակվում են եւ աշխատում են ծերանոցներում։ Մենք կկարողանանք բուժքույրական հաստատություններին օգնություն առաջարկել։ Մենք կտեղադրենք այս համարները մեր կայքում եւ ես ձեզ հաղորդում եմ դիտել եւ տեսնել մեր առաջընթացը տարածումը դանդաղեցնելու ուղղությամբ։ Երբ մենք սկսում ենք հանգստյան օրերը ավելի շատ վայրեր վերաբացումով, ես ուզում եմ շնորհակալություն հայտնել բոլոր ձեզ, ովքեր անում են ամեն ինչ COVID-19-ի տարածումը դանդաղեցնելու համար։ Մենք բոլորս պետք է շարունակենք միասին աշխատել այն ուղղությամբ, ներառյալ ֆիզիկական հեռավորություն գործադրել եւ մեր դեմքի ծածկոցներ հագնելը եւ մենք գտնվում ենք այլ մարդկանց մոտ։ Այս գործողությունները գործում են։ Նրանք պաշտպանում են ձեզ եւ նրանք պաշտպանում են ուրիշներին եւ նրանք կյանքեր են փրկում։ Շնորհակալություն։ Thank you. This concludes the press conference.